Great. So welcome everybody, and welcome to this conversation with myself, John Wilks, and Josephine Sellers, my colleague, and with Emma Bragdon, who's talking to us from the United States. Very warm welcome to you, Emma. Thank you. And we've had you on eHealth Learning.
Thank you so
much. Doing a webinar and also a course for us on the subject we're going to be talking about tonight, which is around spiritual emergency and your work in general as well, actually. So those of you who don't know Emma, she's a transpersonal psychologist and has focused on helping people in situations related to spiritually transformative experiences and spiritual emergencies over the last 35 years. And she's written 2 of the first books on this subject. And I think she's going to be talking about that a bit later. And she also runs a wonderful website called imhu.org, or Integrative Mental Health for You, which is well worth looking at. And I think she'll talk a little bit about the courses that are available on that website a bit later. So welcome, Emma. Thank you for being here. Thank you.
Thank you, John, for the invitation. It's a pleasure.
You're welcome. So we've got a few questions for you, Emma, if that's all right.
Okay.
And I don't know, do you want to fire away, Joe, or shall I?
Yeah, absolutely. Hungry for getting as much as I can get out of Emma tonight that's helpful to the psychotherapeutic movement in this country. We're very interested in this process of spiritual emergency with the potential for spiritual emergence, particularly valid at this time where we've got this almost existential crisis with people locked down and dealing with COVID. So I think it's quite current at the present time. So I just want to ask you, Emma, first, what sort of events would constitute a spiritual emergency, and also what would it look like if that person presented to you? How would you work your way through it?
Well, those are 2 very big questions.
They are.
And we have an hour for the whole interview, so I'm thinking, how can I put this in a nutshell? That's the difficult point, at least for me, Josephine.
The good thing is, Emma, it's all on your website afterwards, isn't it? So if we even have to do it briefly, there's more backup to come off your website.
That's true. We do offer a free course on spiritual emergency. What is it? So anyone can go in and sign up for that. But I'll try to answer your question because it is basic to what I've been very involved with. And some of the catalysts that can take a person into spiritual emergency is an existential crisis, as you were saying, like a real crisis of meaning. And with all of the difficulties that are going on now, certainly in the UK and the United States around COVID-19, and I don't mean to leave out Europe, a lot of people are saying, wait a minute, why we're sophisticated? Why can't we overcome this? Why can't we, have a positive response to a test and then 5 days later be out of the hospital and be on our way to become president of the United States like Trump is trying to do? It just isn't happening. So that crisis in itself and the fear that the COVID is going to take people over really puts people up against a lot of different questions. And speaking as someone in the United States, I would say that the foundations that we've all depended on as being stable and dependable have noticeably cracked and in some cases dissolved for us. And so we wonder, what is really beneath us to support us? So that can be a tremendous catalyst for asking very big questions, not just social and political questions like what's the matter with our government and what do we need next, but really, what are the values that we hold? What are the values that we hold as human beings together? And how do I activate those particular values myself? And especially in a social situation where there's so much polarizing going on, it can be very challenging to be a loving being if that is the value that you take on. So I think, as you were saying, Josephine, that just the situation that we're in now with COVID-19 is forcing a lot of people into some very deep and profound questions. And then the very fact that there's so much isolation. So people are feeling like they can't connect like they usually do. So that would mean, you know, how many of us are getting our 8 hugs a day, which many people will say is what each of us need. And then how much can each of us reach out to other people and get to know other people, have a cup of tea, have a glass of beer, whatever we generally do to get to know someone else and keep expanding our circle. We're cut off from a lot of that. And then just the fact of wearing masks most of the time and masking ourselves, we aren't getting the fluency of gestures and connections and feedback that we usually get. So I'm going into this in particular because I think a lot of the difficulty that can come up for people who are entering into a spiritual crisis is they suddenly feel a sense of disconnection. So they have a spiritual experience that may be really powerful for them. For instance, a near-death experience. And prior to the near-death experience, they never believed it was possible to be out of your body, clinically dead, contacting the angels or people who had previously died, and then come back and actually recover your full mental capacity and remember what happened during this time when you were in a deep coma. So when people have a very powerful spiritual experience, and near-death experience is only one of 12 or 13 categories, depending on how you're counting them, and they all of a sudden feel a lack of connection with themselves, like, oh, the beliefs I used to have are no longer valid. What do I believe now? And so there's a calling to reconnect at a very deep level with ourselves. But then there can be a lack of connection with the people that we've considered as our support network. For instance, if I'm a doctor and I never believed in near-death experiences, and then I associated with people who all had a similar belief, and none of them believed in near-death experience as valid, then I come out of my profound spiritual experience and go, well, wait a minute, where is my support network? Where are the people that I can talk to? And then on a more classic level, and one of the categories is dark night of the soul. On a classic level, that really related to someone who was a monk who felt very strong connection to God. And then at a certain point, just that whole landscape went dry. There was no connection to God anymore. And so there was a kind of despair that came from that. So one of the reflections that I have about spiritual emergency and the catalysts is that it throws people into deep spiritual experience, which might last, moments or days or weeks, but they feel disoriented by it. And they have to reevaluate not only their relationship to themselves and the deepest existential questions of life, but also it frequently brings them into a desire to transform their support network and possibly even their job. And so there's like not only a disorientation, but a need to reorient, to reevaluate, to re-choose what really makes sense. And for many people who have a very profound spiritual experience, it can be transformative in terms of their work. So prior to, as they're having the experience and beginning to take time out to reevaluate, they may have no interest in their current work, not be really able to focus on their current work, not be able to really focus in on just even the family duties and house management that they've usually done. And instead, they desire to be in a more meditative state or be left alone for a while to go through this reevaluation. So the hallmarks of a spiritual crisis are, one, a spiritual experience, either one or several that come simultaneously, and a feeling of needing to take time out and not being able to apply oneself fully to work or family life in the way that to follow the pattern that we had previously.
So that could look like, almost to outsiders looking in on them, as a form of they say it's a form of mental breakdown, won't they?
Oh, absolutely. And unfortunately that happens to a lot of people who go through this experience. I'm thinking about someone that I've been working with recently who at the age of 18 had some sudden experiences where she felt that she was deeply connected to someone she'd never met, but someone who had built the house that she was living in. And then she had she tracked this person down and tried to talk with him, and then realized, wait a minute, he's not being supportive of what I'm saying. And the people around him, who happened to be nurses in a residential treatment center, weren't okay with what she was doing. And she started to feel like she was crazy. And she within a short period of time, she was hospitalized. Yeah. Because everyone decided that she was crazy, including herself. And she's beginning to consider that maybe she had a psychic experience, a psychic opening, which was she was in the house that this man had created and owned. And it was, it had absorbed his energy. And she was able, in a sense, to not only read his energy, but be impacted personally by it, as if she was having or had had a personal relationship with him in the past. Okay. So she had never had an experience like this before. And she was in a foreign country when it happened, which oftentimes goes on for experiences like this that are very liberating in some way, but also can be frightening. You're not around your normal patterns. And so something like this happens and you go, wait a minute, is this what they call a past life experience? Or what's going on that I feel like I know this person and he's still alive? I can contact him. What do I do with this?
So that's quite a holographic experience, isn't it?
That's an interesting word to put to it.
Yeah, it is almost.
Well, that has a more positive spin. Yeah, but for someone who is a very conventionally trained and follows the more biomedical model, it can sound just absolutely crazy. Someone's out of their mind. This is impossible.
And so the person is not seen. So the most important thing going on to how we would help them or move them through any sort of system is to be open and supportive. And then you've got to weigh up this. It's likely that they may be put on medication, and this is a big thing for you, Emma, and I'm really interested in this. I mean, I've had patients come to me who are on, clients come to me who are on medication because they have been diagnosed as psychotic, but they've come to me because they've seen the way I advertise myself, and they know that I understand the potential that there can be more than. They may have been abroad and they've been in a house and they've seen events of the past and things have happened, and they've come to me and they've described what they've been through, and they may have seen, just like you're speaking, like remnants of people who've been there before. And if you can say, well, it's feasible to them, it allows them to relax just half a degree, and then we start to really look into the potential of is it or isn't it, and they may still be on medication, but eventually not everyone's going to blossom out of it, but some blossom beautifully out of it because they hit a spark in you, and you begin to be able to give them evidence, maybe stories, transpersonal stuff that says, well, this just may be happening. So this is the way I've had to do it, but I'm interested in the way you've done it, and you've worked a lot with the Brazilians, and that's really interesting work in their psychiatric hospitals, where they're a mix of transpersonal work, quite shamanic in that it's they're culturally indigenous, aren't they? Still, I think all that comes into. I'm over to you, Emma. I just want you to just give it as you see it.
Yeah. So the question of as a therapist, what would be the most positive way and effective way of working with someone who is presenting with a situation like the one I described, or the two I described, actually, a near-death experience or a psychic opening. And so what I try to do, Josephine, is be respectful of a person's inner experience. So they have the opportunity to talk about it and be open about it with someone who is not going to judge them as crazy because they've had a very unusual experience. So in that way, I release my judgment, and some of my judgment, you know, could be, gee, I didn't know that was possible, or I didn't know that was real, or wow, I haven't had that in my life before. So to release all of that, and in a sense, just be non-judgmental and accepting. But at the same time, it's really important, especially for those of us who are in the role of a psychotherapist or a body healer, energy worker, yoga instructor, who might, you know, have someone in this situation, to recognize that oftentimes when someone has a spiritual crisis, meaning a big spiritual experience, and gets very disoriented by it, that actually there's something else going on in the psyche, which it starts throwing up other things. I don't mean that biologically, but more as an image. Other things come up from the unconscious that can be very psychological in nature. In other words, not particularly spiritual. For instance, it's not unusual for people who are having a very powerful spiritual experience to all of a sudden remember that they'd been abused as a child, and they'd never had access to that particular notion before. So along with having to orient themselves around what am I experiencing with the spiritual stuff, up comes this other business of what is that real? And then of course, all of the really profound feelings that can come up. For instance, fear with the spiritual experience, especially if someone doesn't have a framework for it. So that can cause a lot of fear of the unknown. And then on the other hand, this need to evaluate, was I really abused, and who did it, and what happened? And that was really scary. In fact, it was so scary, I decided to put it on the shelf for the last 3 decades or whatever. So I think the best approach, if one is in the role of a psychotherapist, is to be able to be very respectful of what's going on with the person, and why, and they're coming for help, and they're needing to sort out the spiritual experience, but also recognize that the person may have a lot of psychological stuff that has suddenly shown up that needs to be also integrated. And in some cases, people are really deeply disturbed by the psychological material that's come up. And in those cases, you know, sometimes people need to be in a secure environment. And I certainly would never sign myself up or anyone else up for an isolation room in a psychiatric hospital. So I'm not talking about that, but I'm talking about a secure environment, meaning an environment where they're looked after and dealt with in a compassionate manner, but also someone is making sure that they have adequate nutrition, that they can get enough sleep. That to me is a secure environment.
And that's what happens in Brazil. You've been there a lot, Emma, and you talk and write about it. And their way of dealing is a very integrative way of dealing with it, isn't it?
Well, again, this is something I usually talk about for an hour, but how do we collapse this into something relatively short? But so yes, in Brazil, I have a group of lovely associates who are most of them are psychiatrists and medical doctors, and they have recognize that some people have been repressing aspects of themselves, for instance, their own psychic sensitivities, and that at a certain point, if we continue repressing actually any aspect of ourselves, it starts bleeding through, right? And we have to deal with it in some way. And if someone has grown up with social conditioning that says basically don't go there into the psychic realm, but that person is actually very gifted with psychic abilities, then it can be a very difficult conflict, not only innerly, but relationally. And that person may experience a great deal of disturbance from it. So if someone is very disturbed and enters into a spiritist psychiatric hospital, and I'm not saying it incorrectly, I don't mean spiritualist, I mean spiritist, which is a subculture of spiritualism, they are treated in the same way that we would in the United States, which is they're given a full workup by a medical doctor to see if there's any organic problem. And they're also able to talk to a social worker who will assess the psychosocial stressors. For instance, has someone recently died? Did they lose their job? Did their partner want to divorce them? Things of that nature can be important, as well as are they subject to racism, poverty, etc. So all of those, of course, will impact anyone. And then on top of that, those kinds of assessments, which are more conventional, is an assessment by a medical intuitive. And the most gifted medical and well-trained medical intuitives in Brazil, who work in the spiritist format, can see into a person and recognize not only where the disturbance comes from, but the kind of pathway to manage that disturbance. And so, what becomes possible is someone may come in deeply disturbed. Anyone would say this person is psychotic. They're hearing a cacophony of voices. They're experiencing rodents crawling all over their body. They're nuts. Everyone will agree. But in one particular case where a man had that experience, he went into a spiritist psychiatric hospital, and he was totally fine organically, and he didn't have any particular psychosocial stressors. But when he reached the medical intuitive, that person could see, oh, he's actually an energy worker and a channeler in the rough. He has no cognitive framework around it. In fact, he thinks spiritualism is absolutely crazy, and so he must be crazy if he takes it seriously. And so he needs to be around people like himself and recognize that he's not alone with it, and that it can be seen as a gift, and it can actually enhance his own life, as well as be used in a way that's a gift to other people. So I'm telling, actually in brief, the story of someone that I met, and he became an extraordinary healer. Whereas earlier in his life, when he met a conventional psychiatrist who was of the most well respected in Sao Paulo, they were convinced he was psychotic, schizophrenic. That's it. Signed, sealed, and delivered.
He was a lucky man.
Can I ask, Emma, you this person you mentioned before who'd been in this house and sort of felt this connection with the person,
yeah,
who'd renovated it, and I'm just wondering also, like, how did you have any contact with the people that were sort of treating her, and the more conventional kind of psychotherapists or psychiatrists, or whoever she was? I mean, how did you language that with them?
that's a great question.
Was that not possible to do that, to start
Well,
a
actually,
conversation around it?
Yeah, I suggested to her that I really like to do teamwork. And I had asked her when in the first meeting that we had, are you in psychotherapy now? Are you seeing a psychiatrist? tell me about what your support system is like right now. And she told me that she was consulting a psychiatrist once a month, and she was also in a more conventional psychotherapy. And I said, you know, I would be happy to do teamwork so that I can converse with these people, but that's totally up to you, and you would need to authorize it. So I'm certainly not going to go beyond anything that you would authorize.
Mm.
If she had been suicidal, John, then I would have actually said, especially in these days where we're doing telemedicine,
Yeah, yeah.
I would have said, I'm sorry, I can't work with you unless I'm in touch with other people in your location who you might turn to if you had an emergency.
Mm.
So, but with this, you asked me about this particular person, and she is not suicidal. And she is very intelligent, well-educated, very disciplined, and very directed right now. She really wants to grow, and she wants to withdraw from all meds, and she's trying to pace herself. And I've spoken to her and said, you know, I am not in a situation where I can give you any advice because I'm not a medical doctor. I can't advise you about withdrawal from psych meds, but I can point you in the direction of some of the kinds of people that might be helpful for you to be in touch with. And so that's been an important avenue of discussion. And my personal opinion around that is any kind of drug withdrawal has to be done with extreme caution and responsibility, and that it really is best to have a medical professional, an MD, on your team who is well trained in this area, which is quite hard to come by in the United States.
Yeah.
I want to say, Emma, this teamwork approach is the fascination to me, and the huge need for it. And you know, people with different disciplines and knowledge to work as collective. It seems to me the only right and safe way to be working. How on earth do we get that sort of thing going in this country?
Well, anywhere in the world, you know, but
it's nice to know it goes on somewhere, Emma, and we have something to model and look upon.
well, I do my best, you know, when I'm in private practice in the United States. But when I'm in Brazil, and I do take healthcare providers once a year when we're allowed to travel, but I generally take healthcare providers once a year for a week-long seminar to learn about the Brazilian Spiritist paradigm. And the teamwork approach there is just extraordinary to me. So not only do the energy workers who, for instance, go into the Spiritist Psychiatric Hospital and work on the patients, they generally work as a team together. So they're not alone in a room with one patient. And all the patients instead are in a room all together as a group, and there's space in between them so that the energy workers can pass in front of them and have space to work on each person 3 to 5 minutes. So
sounds absolutely wonderful, Emma. It sounds just right.
Yeah, and so that's important. But then they also do for those patients who don't respond to the energy work as well as the other kinds of things that they offer at the hospital, many of which you'd find in a conventional hospital, like art therapy or working in the garden or physical education or group therapy. But if a person is not responding to any of those more conventional treatments and is not really making progress also with the energy work, then they might go into, with their permission, they might be the subject for a disobsession meeting. And this is really a shamanic practice. And the spiritists don't call it shamanic, but having studied shamanism for 20 years myself, I can recognize the resonance there with shamanism. And basically the belief among spiritists is, yes, we do have meaningful connection to the spirit world. And it is possible for negatively motivated spirits to impact us.
Yeah.
And in fact, even attach to us and insert mental patterns into our thinking process. So one of the things that they do in the disobsession meeting, which is disconnecting the obsession, right?
Yeah.
Is quite shamanic in that people who are extremely well-trained mediums can actually perceive what if there is a negative entity there, and even interview that being. In other words, why are you attached to this person? Why are you impacting them? What have you got a prior history with this person? What's your intention? And so once that information has been gleaned, which can actually go into the patient's report along with the conventional psychiatrist's report, but once that information is gleaned, then there's actually a process where they try to help the negatively motivated entity, spirit, to go further into the light, or to transform themselves, to improve themselves, to have a better quality of life. And so the separating from the patient will relieve the patient of this negative pattern of thinking and negatively motivated entity, but it will also liberate the entity.
I understand this work, Emma, and I know that it actually does have actually miraculous effect. But you know, you've got to have extremely gifted people to do that sort of work. I would say it's like dispossession, a removal of attachments, sending the attachments towards the light to move on, and then see this release within the person. But that's unusual work for the mainstream therapeutic community to look upon.
Oh, absolutely.
I do understand it. I do, and in that respect, that's why I probably feel quite isolated at times. But I do know that through the shamanic training, within them, I get community and understanding. We seem to know so little about ourselves, even now in this century. Maybe the ancients knew a lot more than we are able to deal with, but we do seem to be awakening, and there's masses of books out there these days upon these subjects, which is very relieving to see, and in a way exciting that there is hope for movement there. And I think your work is, and your books and what you write about, is inspirational. Well, it is for me, but I know it will be for other people I know along that, and in the psychotherapeutic community, particularly those engaged in the transpersonal work, which makes allowance for this. And we're forever exploring, aren't we?
Yes. But Josephine, I do want to say that in Britain, there are several very well-educated psychiatrists who are part of, I'm trying to think of the name. It's the Royal something group of psychiatrists. Maybe you could remember, or John would remember the name. But a man by the name of Alan Sanderson comes to mind. And the particular interest group that they had is into studying things like spirit release. And actually there are publications that they have created, articles on spirit release. And one of the things they've said is, you know, you don't have to push onto a client the fact that there are spirits around that are impacting them. It can be totally frightening for someone.
Absolutely.
And a psychiatrist, psychologist, counselor doesn't have to totally believe in it themselves either, but to recognize that, you know, if someone is deeply disturbed, they may in fact have a pattern of thinking that just continues and repeats and repeats and repeats, and it almost has a life of its own. And so you can approach this disobsession from that point of view and never even mention the spirit realm. And so I think that's a very important point, and it can be extremely effective to to work with like a pattern of thinking that someone gets obsessed with, and work with that as if it's a separate entity, and maybe a subpersonality. We can turn to Roberto Assagioli
Yeah.
or others. And so it can be dealt with in that way. So you don't have to embrace shamanism or spiritism in order to do this kind of work. But I think one of the things we can learn from spiritism is that this work can be highly effective, highly effective. So I've met people who were diagnosed as schizophrenic who are now university professors teaching physics, for instance.
I hope, Emma, that you will impart some of this information, these names, and where it's approachable in the UK, because I personally would be very interested, and I'd like to follow it up a bit.
Okay, I can, well, Alan Sanderson is one name that I gave you.
I've written it down. Yeah.
Yeah.
Okay, well, that will start me off. And
Okay.
also I can feed it to other people, other psychotherapists I know.
Emma, can I ask you something you said before, which was you were saying about how sometimes when you go through a spiritual emergence or something, you then some difficult memories might come up, for example, and I'm very intrigued by this, because there's a process that seems to happen, I think, particularly with sort of more in sort of Kundalini awakening, that process seems to happen. There seems to be something which kind of doesn't want anything to get in the way of that, and so it will throw up all kinds of your shadow, you could say, or
Yes,
trauma or something like this.
yes.
But conversely, and I've seen this a lot in myself and in others, but conversely, it also seems to be true that early experience or difficult experience or traumatic experience can also trigger spiritual experience. I know that there has been a little bit of research around this with people who undergo things like early sexual abuse or something quite traumatic, where they seem to be more open then to spiritual experiences, which I find interesting. I'm just wondering, and also the other thing that I found in my work, because I'm a body worker, I'm not a psychotherapist, but when there has been extreme trauma, it also seems like, and I can often feel it almost in the room, that there is more grace. I would call it grace available. I don't know what else to call it, but there is some element of kind of bringing this more into the kind of spiritual realm. I don't know. That's all I can say about it, really. I'm just wondering if you could, because there's kind of two aspects to it, isn't there, really? Like early experience triggering some kind of spiritual awakening, and then at the same time these things coming up.
So two things come to mind with that in particular, John, and that is one, I was teaching on Tuesday to a class on how to effectively support someone in spiritual emergency. And I was introducing them to ways of assessment. And I was telling them a story about a woman who was incested by her father, and she had some pretty severe physical issues that were related, having to do with her period. And she was clearly cognizant that she had been incested and that was traumatic, and she was doing what she needed to do to work through it. But one of the things that she said was, when she was being incested, she actually had a spirit guide who was very available to her and basically comforting her in a way and saying, this too shall pass, and this will not be the nature of your life forever, and have faith. And so it wasn't exactly, I can't say it elevated her. How could you be elevated in the midst of an incest process? But it gave her a connection that was extremely meaningful. And as she and she was very open to forming a trusting relationship with a psychotherapist or a body worker or someone who could be her helper as she was working through this difficulty. So she was actually very open to forming that kind of a relationship. And in the process of working through it, in which she was successful to remove herself from some of the impact of the trauma, she maintained her relationship with that spirit guide, who is now very much a part of her life, and that spiritual domain remains close and of comfort to the person. And so that was a very successful resolution for her particular situation. And you could say from your point of view, there was grace that was with her, even in the worst of times.
Yeah.
Emma, can I say that? Sorry.
No, I was just going to say that I was very struck yesterday. We had an interview with a psychotherapist, Ginny Dobson, who's worked a lot with the Yazidi women in, who went through these absolutely horrendous situations with ISIS, where all their menfolk and children got killed and stuff. And they have a very, very strong, very, very strong faith. And you could see from the pictures there that, and also the way they talked about it, was that they were very clear, because she asked them a question about shame. Do they not feel shame? Because a lot of people, actually in that situation, if they've been raped and stuff like that, they feel shame. And they said absolutely not. They don't. That's not something they feel, because they know, they're very clear about what happened and who did this to them. And I'm sure that part of that was their kind of spiritual understanding. And it's very sad, I think, nowadays, that you have this situation, and you get it a lot on the radio. There's been a whole series on the radio this week about touch, and it's usually couched in this terms like, well, when you were touched, you release endorphins and all this kind of like neurochemical. That's how it's framed, isn't it? And that's all that's important these days. It's very sad, and people. Anyway, I'm just saying.
So I just want to say up another thing, John, and I'm sorry, Josephine, I know you have something on your mind.
I'll stop talking.
But John asked a question that I said brought up two things for me. And one is that when you said that a person can experience a lot of grace as they're working through their deepest trauma, you've experienced like grace in the room. And I just want to say that I think that says a lot about you and your work. Because if you have done some work with yourself, opening up your own emotions so that you're more fluid and okay with your emotions, but also with your spirituality, that it allows that to come into the space and be available to someone, even if they're in their deepest trauma. And that kind of allowing that kind of connection can be one of the most healing aspects of what we can bring to clients. So our own deepening process can of course help someone. And one way to illustrate this further is just to say, if that particular client you were thinking of, instead of coming to you, went to an emergency room where there were bells ringing and flashing lights and people screaming and blood on the floor, and the chaos that's there. And then people just applying, attention to, okay, you're in crisis. Oh, okay, you're having an experience that seems like it's out of touch with reality. Well, let's give you an antipsychotic immediately. And it's taken care of in that way, which is, there still may be grace that's available, but it would be much harder for that person to connect with it in that situation.
Sure.
So that's an honoring of your work.
Thank you. Yeah.
And I would call that, you can create a sacred space, and they feel held in a sacred space while they're with you. And you develop to be able to hold that sacred space to do so. The thing I wanted to just say that sort of to give a diagrammatic form of that for me, which always helps me, is that wonderful egg diagram of psychosynthesis, where we can see the parts that we can go to. And if one opens, if you open more into the higher self, then it's quite possible that the deeper subconscious will open. It's like a loosening of all these places. So maybe this is why we get repressed stuff from the deep subconscious that might relate to abuse or trauma in childhood coming into play at the same time. It's as though when we have these spiritual emergencies, it's like a loosening, and we see more than we've ever seen before, and it all comes up together. And I think that egg diagram shows the potential for those places. Would you not agree with that,
Sure.
Emma?
Yeah, that makes a lot of sense. And I think
someone wanted to see what would it look like? Well, this is how it could be perceived. This is our psyche in its totalitarianism.
yes. So I'm not sure if you're asking me a question, Josephine. I didn't get it.
If you felt that was relevant, Emma, that the egg diagram of psychosynthesis was relevant to what we're talking about, where you've got deep stuff coming up from the past, but also slightly an opening up to spiritual events as well. It all happening at the same time.
Yes, but I think it's important that we don't make too much of a generalization here, because I think as therapists of all kinds, including body workers, it's really important to meet each person in a very unique, in their uniqueness. So yeah, so yeah, not to say that you weren't saying that, but I hesitate to get into any big generalizations, because you know, some people will open up on a spiritual level, and they may have a huge satchel from their unconscious of negative experiences and not be really ready to look at it for quite a period of time. And so to even think about, okay, so this, you know, you begin to open up the deep unconscious and spiritual experiences come out, but then also other things rush out, doesn't necessarily apply to everybody. Do you understand what I'm saying?
Yes, I'm just thinking that for someone who culturally has no, or even psychologically, we have no psychological training, very little in school or education, that we understand a lot more about our bodies than we do our psyche when we leave school, unless we specialized in that. And that's another big thing for me. If we understood that we're huge in our psychology, as we are huge in the magnificence of our body, but we're not, and that leaves us vulnerable, I feel. So a big beef for me is, come on, let's teach our little ones from a young age, and as they go through, to understand the anatomy of their psychology.
Oh, I 100% agree with you. We have physical education. Why don't we have psych education? You know, every single human being is going to meet up with some kind of intense emotional experiences in themselves as well as with other people. And we don't prepare our kids for this. I wasn't prepared for it. I had a very good education, considered to be a very good education. There was nothing in that realm, nothing. So maybe you could say.
I'm glad we agree on that one, Emma, because I think as we go forward in the world, out of what we're living through now, something really needs to shake up in the education system. So that our little people can grow into more self-knowledgeable adults and young teenage people, that they can handle their life in a much more self-sufficient way. They deserve it. We owe it to our children.
Yeah.
Emma, I'm just wondering if you've got any thoughts about when, you know, when you look back at history and you look at the relationship between say people who are going through a difficult time emotionally or mentally, having breakdowns or whatever, then it was all, as far as I can see, back in the, you know, as far back as you can go in history, it was always the case that would be seen as often as a spiritual crisis first of all, or something to do with a lack of connection with the earth. And a lot of shamanic practices obviously help to reconnect with the earth, or with other people, with the tribe, etc. And and I guess I don't know when this happened, but and it's a progressive thing where that there is a distrust somehow of spirituality. Now I'm just wondering why that happened, and how we can kind of repair that in a way. I wonder why there's such a distrust of spiritual experience or spirituality generally.
That's a great question. I'm, as you know, John, I'm a student of the Self-Realization Fellowship.
Yeah.
Is more yogic in its philosophy. And one of the beliefs that comes along with this package is that we're coming out of Kali Yuga, which is a time that has lasted for a good period of time, over 1,000 years, where people would say it's not real unless you can touch it, taste it, you know, hear it.
Yeah.
In other words, approach it from your 5 senses. And the Kali Yuga is thought of from a yogic perspective, yogic philosophy, as the darkest of dark ages. And we're just now, in the last 200 years, coming into a zone where we're opening up our minds and our hearts and our spirits again and saying, wait a minute, what about the 6th sense? What about intuition? What about psychic abilities? What about the arenas that the shamans know about? And so there's more attention to that realm, but it also means that more people are spontaneously opening up and being able to see subtle energies and things of that nature. But you know, if you ask a question about history, I would just say that at a certain point, and this is like, I couldn't put my finger on it exactly, but certainly before Christ, you know, we really were into the Kali Yuga, and we started to just back off from our natural ability, which the indigenous people generally have and stand for, to be connected to the earth, to be connected to even psychically the animals and the other beings. And it fills me with sadness, actually, just to think about how much we've cut off and how we still transmit that particular kind of blinders, you know, to our children and grandchildren, and that people are beginning to open up more. But you know, this Kali Yuga phase has been going on for a long time. The good news is, at least in the yogic philosophy, is that we are coming out of it. We are transitioning to a higher age, and there are even more higher ages beyond us. And yahoo, we're on our way. But it's going to take hundreds of years to fully integrate this.
Yeah.
And so we have to look.
I would go with that.
Yeah, we have to look at science and technology as basically it became like our religion.
Yeah, exactly. Yeah. I know
I would actually go with that. I think we're living in amazing times. We are morphing into what we could be again.
Yeah, we
Emma,
do live in amazing times.
I know we got to stop in a minute. You got some couple of slides you wanted to show, was it?
Yeah, I put together some slides just on my contact information and on my books. And shall we see if I can get this to work with share screen?
Yeah, I may have to make you, let me see, I may have to make you a co-host. Let's do that for you.
Okay.
Yeah, and then you can share your screen. Okay. Yeah, cool.
Let's see if.
Yeah, there we go. The elephant.
Yeah.
Yeah, you've seen that before. I was fortunate to spend time in South Africa, so.
Oh, beautiful.
Thus, I feel very close to the elephants.
Oh.
Okay, so this is just to let people know that I am the executive director of the Integrative Mental Health for You website. And within IMHU, we're now presenting over 34 different courses. Some of them are taught by me, some of them are taught by psychiatrists, social workers. I generally picked people to represent psychology and all aspects of counseling who had academic credentials, because I want IMHU to be a bridge from the more conventional way that we've been taught to practice psychology, psychiatry, psychotherapy, body work, etc. A bridge so that they could move into more of the newer technologies for working with people that don't over rely on psychiatric medications. So IMHU is not against psychiatry or against psychiatric medication, but we do want to inform people that there are a broad range of therapies that do not rely on psychiatric medication that are extremely effective. In fact, there's lots of publications behind them at this point. So we can really go into that territory. And most practitioners don't have time to educate their clients. And so being able to send someone to into an online course can really help them see what kind of alternatives or effective supports might be available. The other thing to say about IMHU is that we do feel that spirituality, and which has many, many components, it can be a really positive, make a positive contribution to optimizing health. So a lot of our courses deal with spiritual emergence, supporting spiritual awakening, looking at how spirituality or spiritual practices can enhance and optimize mental health. Okay, so the books that, most of the books that I've done are here. The first book I did was called A Source Book for Helping People in Spiritual Emergency. And when the Diagnostic and Statistical Manual of Mental Disorders first recognized that there can be spiritual or religious problems that present between a client and a therapist, then I changed the title because I wanted, again, to be more of a bridge to the conventional world as they came into a deeper understanding of what spiritual problems were all about and also how to manage them. So that was my first book. That's in the upper left. And then Harper San Francisco asked me to write a book that was full of stories, like what happens to people in spiritual emergency, how do they resolve it, what happens as a result of a spiritual emergency when it's well managed. So The Call of Spiritual Emergency is full of stories. And then the cover that has a whale on it is called Resources for Extraordinary Healing: Schizophrenia, Bipolar, and Other Serious Mental Illnesses. So I was really looking into some of the very effective therapies and therapists that are alive today and the effective work that they're doing. At the bottom left, the newest DSM is, you could say it's a satire on the Diagnostic and Statistical Manual of Mental Disorders, but I took DSM, those initials, and instead had them represent deliberately seeking mental health. And so it's a satire, but then on the other hand, it's full of really good grounded information about optimizing mental health. And then on the upper right, Kardec Spiritism with the dandelion seeds is a book that offers people an entrance into what is going on in Brazil with spiritism, with the spiritists that follow Allan Kardec, who was an academic in France. So there's a lot of misunderstanding right now about who belongs to spiritism, and it does not come from the indigenous peoples of Brazil. However, it comes from Allan Kardec, who was a French academic, as I said, but spiritism fell on very fertile ground in Brazil because so many of the indigenous people, indigenous to Brazil, as well as the African slaves that came over to Brazil, were willing and very used to considering that spirits are a big part of our world and need to be worked with as we're optimizing mental health. So that book just describes several different kinds of spiritist centers that follow Kardec. And then on the upper right is actually the cover of a DVD, a documentary film on Spiritism, which is available through Gaia.com for anyone who wants to just review it. It's also, all of these books and videos are for sale on Amazon. And then the lower right is Spiritism and Mental Health. I've written several chapters in it, but most of the chapters are written by spiritist psychiatrists and psychologists and researchers from Brazil, as well as some researchers from the United States and the UK that can illuminate what they feel is the value of Spiritism. So that is a more academic book, very, very well referenced, but it's also quite easy to read if you haven't got a graduate school education. So I try to make all of the writing that I've done very accessible to people at all levels of education.
Wonderful. And the course is on your imhu.org site.
Yeah, so if people want to look into what we offer, imhu.org is the URL to look for. And we actually have a parent organization called the Foundation for Energy Therapies. And we're doing business as IMHU at this particular point and into the future. So we do have a free newsletter so people can hear more about what is current, about also blogs that are put out almost every week. But a lot of our courses are just available 24/7 wherever you are because they're recorded, and some are live. A couple of them are live on location, like the one in Brazil, but most of them are recorded, so they're available all the time. There is a Facebook page, which is listed right here, IMHU2. And then if anyone wants to contact me, my contact information here is here, as well as you can go to the bookstore on our website and get more information about the books, as well as the link to Amazon to purchase. But I do want to say that I do telemedicine, as it were, not medicine, but using Zoom to do counseling, and I counsel with people from all over the world who, because they recognize that there aren't that many people who have such a focus on spiritual emergence and emergency and how it interfaces with psychiatric issues. So I'm available for that kind of counseling as well as more conventional counseling.
Wonderful, thank you. And Emma's also done a course for us on e-health learning for therapists who are working with people going through a spiritual emergence or spiritual emergency, and that's available from ehealthlearning.tv as well. Great, thank you so much, Emma. That was wonderful. Is there anything else you want to say before we stop, or Joe?
No, it's
I
just...
just want to thank Emma. Pleasure to speak to you, Emma. I think your work is inspirational, and I'm going to make sure that we push this around as far as we can onto the other channels as well, Emma. Thank you for taking the time. I'll do what I can with your stuff, but I think it's wonderful. And I think we're in a process of waking up in the world, and people need as much information as they can possibly get these days. And to come from someone who's written so many books and has such a good reputation in academia with it all, and her interaction with the other facets of the medical profession is wonderful. This is what we want: stability and foundation as we move into the times we're in now.
Yeah.
Thank you, Emma. It's a pleasure.
Well, thank you, Josephine, for the invitation. It's been a pleasure to be with you, and John, to be with you again. Thank you very much. I appreciate it. And I just wanted to say, Stan Groff has been a big influence on my life, and we're showing a film of his, honoring his life and work Saturday, which is tomorrow, but it will be available for those people who live in the UK and EU, because we'll have it online for over 24 hours. So it's a film as well as a panel, and people can access it through imhu.org.
And I also wanted to say how reasonable your courses were in price, Emma.
Oh, well, thank you, Josephine. That's hard thing.
That's very noticeable.
Yeah, and quite a few are for free, actually, aren't they, Emma?
Yeah.
Yeah.
Yeah, several for free. Well,
Thank you.
Okay.
Great. Thanks,
very
Emma.
much.
Thank you, Joe. Bye-bye.
Thank you, Emma. Thank you.
Bye.
Bye-bye.